in the area. Bentura Kwamboka, KTN.
The government has now shifted its focus to truck drivers along the Busia-Malaba border in its fight against the deadly Ebola virus. And as Milia Kisienya reports, residents along the border continue to raise concerns over the inadequate preparedness, even as the World Health Organization reports of a positive progress in the handling of the Ebola outbreak.
As the government steps up its pace in fighting the deadly Ebola virus, the Busia-Uganda border continues to be a point of concern. At least 1,500 to 2,000 residents cross the border point daily, which is the country's busiest entry point and a key transit corridor connecting Kenya and Uganda and the Central Africa. And as that occurs, the inadequate resources in place to keep the Ebola virus at bay now poses as a major risk.
Ukiangalia area hii choo ya hapa iko karibu kilomita moja kutoka hapa. Watu wameshuka kwa basi nasimama hapa. Wanataka mahali pa kujisaidia hakuna. Mtu anaweza kuwa anasema anaweza kujiosha mikono pengine. Lakini pengine kwa haja kwenda kujisaidia usafi kamili haiwezi timika.
At least mungeleta sasa zile vitu za kama wakati ya corona zile kama nini na kunawia kama chang'aa hiyo kalikali ya wateso hiyo ndio watu wanawe na hiyo.
And as Busia residents raise eyebrows over the Ebola preparedness, for others the need to follow the WHO guidelines is of great concern.
Biashara tunafanya lakini wakasa wao wenye wanakuja sisi pia tunawasimamia mbali kwa sababu sisi wengine tayuna tu sanitizer lakini ule akikuja usishike yeye unapatia ishe na nataka yanaenda.
While doing a spot check at the Malaba border point, Public Health PS Mary Bodoni says the government has now shifted focus to truck drivers with approximately 300 trucks passing through the crossing daily.
That every week we have sensitization of truck drivers on what is Ebola, how Ebola is transmitted, and how they can stay safe. So it's a very, very busy border. And because of the proximity to Uganda, we are very keen that we are at high risk.
Meanwhile, at Taveta One-Stop Border Post, Principal Secretary for Interior Raymond Omolo noted over special training for all staff at all border points in the country to ensure adequate preparedness.
Working with all our officers at our points of entry and exit is to ensure that there is adequate preparedness to be able to handle and deal with any case as and when it arises.
The latest Ebola update from the WHO indicates that at least 452 confirmed cases, including 82 deaths that have been reported in the DRC Congo, while the neighboring Uganda has so far recorded 19 confirmed cases, including 2 deaths. Uganda has closed the DR Congo border following the outbreak. Meanwhile, WHO says 4 Ebola patients have recovered in Uganda, while 8 have recovered in DRC Congo, welcoming news to health authorities in the region. Milia Kisienya, KTN.
Thank you, Milia, for that story. But remember that tomorrow on Kenya's Bold News,